Hi there, my name is Simon Waddington and I've been working in gene therapy since around 1999. I was working for the first 5 years or so on gene therapy for haemophilia and for cystic fibrosis, and during this time, up to around 2007, I became aware of the likelihood that gene therapy would be used as a standard treatment, a standard cure for haemophilia and some inherited genetic diseases such as inherited night blindness, possibly by the end of the 2010s. And so in 2007, with my colleague Dr Ahad Rahim, we started to look for more challenging targets for gene therapy. We met two clinicians at the Royal Free Hospital in North London, Darylyn Hughes and Atul Mehta, and they pointed us in the direction of Gaucher disease, specifically neuronopathic Gaucher disease, as a possible target. And through them actually we were then introduced to Tanya Collin-Histed, Jeremy Manuel and others at the Gaucher Association UK. We first faced several challenges. So one challenge was getting a proper mouse model of neuronopathic Gaucher disease, and we were lucky enough to be kindly given the mouse model by Stefan Karlsson in Lund in Sweden, who had developed the mouse model. We also faced a challenge of getting an appropriate gene therapy vector, and this would be the gene therapy to treat these mice. And again, we were very kindly given batches of gene therapy vector by Dr Seng Cheng at Genzyme. And then the third major challenge was that this was an incredibly severe genetic disease. So infants with acute neuronopathic Gaucher disease, they perish before 2 years of age quite often, and the mouse model, the knockout mice, they don't live beyond 15 days. And so in fact our project plan to try to use gene therapy to treat the mouse model was met with considerable scepticism by experts in the field of neuronopathic Gaucher disease, and actually is that we were quite doubtful as to whether we would be able to make any difference to this mouse model. We realised that we would have to inject the mice as young as possible, and therefore we injected them either before they were born or just on the day of birth. And then actually is that much to our surprise, we found that every single mouse that we had injected was at least partially cured, to the point where instead of perishing at 15 days of age, they then lived for several months. They looked healthy, they didn't show any of the motor symptoms or paralysis that the untreated knockout mice showed, and also is that they were fertile, and so therefore they were able to breed. So we were quite astonished by this, given our modest expectations, but we proceeded to do a full, very comprehensive study, and we were very pleased that a few months ago this was published in Nature Medicine. So now we are working with Apollo Therapeutics at UCL to validate even more effective gene therapy vectors in the mouse model, which we then hope will subsequently be used in human clinical trials for Gaucher disease, and perhaps even clinical trials that might take place within 5 years or so. So again, there's quite a lot of work to be done, but we are now seeing the possibility of at some point soon, relatively soon, there being clinical trials. We've been working on this project now for about a decade, and during this time Ahad Rahim and I and our colleague Julia Massara, who recently joined the team, we've had a great privilege of meeting numerous people and their families suffering from Gaucher disease and particularly chronic neuronopathic forms. We've spent time at many patient-oriented conferences and witnessed firsthand the difficulties that they face with their disease, the difficulties in getting effective treatments. And we've also had the opportunity to be able to tell them about our research, keeping them up to date with the recent progress that we've had with gene therapy for Gaucher disease, and we're looking to continue working on this and taking this towards clinical translation over the next few years.